Welcome to the Awakened Hygienist. My name is Tara, and today's video is about the dental hygiene assisted hygiene schedule. I'll start this video off with a story. And the story is 20 years ago when I graduated hygiene school in 2002, I was temping around trying to find a practice that I wanted to work in. And one of the very first offices in the first week that I worked at was had a schedule of assisted hygiene. And I had been a dental assistant previous to that, so I understood what assisted hygiene meant. And so I went in, I temped in the office, and it was great, actually. Everyone got along. The assistant was, man, right on it. He was, placing my patients in the room, taking the necessary x-rays that needed to be done, reviewing medical history. And what I was doing was bouncing from room to room. And my schedule was set at about 40 minutes. And so I was seeing a patient every 40 minutes as a brand new hygienist. So anyway, I dealt with it well because, again, I had been an assistant. So I was very familiar with my way around a dental office and knew how to talk with patients and just felt very comfortable in that sense. So it went really well. At the end of the day, they offered me a job and I declined. Why did I decline? Because I told the office manager, although this is a great practice, all the staff is great, everyone gets along, everyone seemed happy. If I do this schedule, I will burn myself out in the next 2 years. And I couldn't do that to myself. So that's what this video is about today. It's about the assisted hygiene schedule and what is happening to dental hygienists. So if you're a dental hygienist watching this video, I want to ask you this question. Are you a teeth cleaner or are you an oral health prevention specialist? Because there's a difference here. And if you're a dentist watching this video, I want to ask you, do you just want to have an office of teeth cleaners? Is it all about profit? Or do you want to have actual oral health prevention specialists working with you? So this is a big deal. This is happening all over in all offices across the country. And hygienists are getting burnt out, stressed out. And I have to ask, how in the world do you do it? I temped for 1 day in an assisted hygiene practice. And I, at the end of 1 day, was done. I knew my boundaries. I knew that if I chose to do this, even though I was offered this amazing office I could have worked at, I knew that it was going to burn myself out. So these are issues going on, and I want to talk about boundaries. If you're a dental hygienist watching this video, boundaries are super important. And if we are willing to work on a schedule where we are seeing patients every 30 to 40 minutes, what are you actually accomplishing in that time? You may have an amazing assistant who is seating the patient, taking the x-rays, reviewing the medical history. But for me, I know as a hygienist, even if the assistant is reviewing the medical history, when I go in, I still need to review the medical history. I still need to be caught up. I need to know what's happening with this patient because I take my job seriously. I'm a healthcare provider. You are a healthcare provider. So we need to know this information, right? So then we start the cleaning. Let's say the patient has their wisdom teeth extracted, so they have 28 teeth. Well, I know for myself, I probe at the beginning of every single appointment because I want to know if, they have a root fracture. We can have all threes everywhere, and then all of a sudden we have a 9mm pocket. So I probe every time I see a patient. So that's 1 time around the mouth. Then I ultrasonic the entire mouth. That's 2 times around the mouth. Then I hand scale every single tooth. That's 3 times around the mouth. Then I polish, even though we know there's selective polishing. Patients want to be polished. So that's 4 times around the mouth. And then I floss. That's 5 times around the mouth. So 5 times around the mouth, 28 teeth being treated. Plus, I'm also, looking, figuring out what's going on. Did I miss anything? Do I need to see anything? Is there anything I need to catch for this patient? And I'm doing that in 30 to 40 minutes. I mean, is that even possible? For me, it's not. And I've been a hygienist for 20 years. For me, it's not. But I also don't view myself as a teeth cleaner. And I don't allow the office that I work in to view me that way either. That's my boundary. So are there dental offices out there that simply want someone to come in and just clean people's teeth? I will use the term oral janitor because that's what a friend of mine who's a hygienist who would call us. Are we oral janitors? And I don't want that title, right? I prefer the title of the oral health prevention specialist. I'm a healthcare provider, and that is what I'm providing. Okay, so a side note, what else are we talking about with the patient? Are we doing tobacco cessation? Are we talking about their nutrition, their lifestyle, what's contributing to their inflammation? Those are things that assistants aren't doing. So what are we leaving out when we are doing assisted hygiene? So for those of you who are listening who love assisted hygiene, if you want to keep doing it, go for it. But if you are a hygienist who doesn't want to do assisted hygiene, but feel like you're being forced into doing it, or that you can only have this work at this office if you're doing it, then this isn't about the office. These are questions you need to go within and ask yourself. Why are you willing to sacrifice your boundary and the treatment that you're providing your patients? Are you willing to truly sacrifice that? I know personally I'm not, and I don't say that in any judgment form. I'm just saying this is what's happening. So let me also ask, how many times have you as a hygienist had a new patient come in and you're looking around, evaluating, assessing, and there's subgingival calculus interproximally, and the patient's like, I go to get my teeth cleaned every 6 months. Interesting. Because my first thought is, I wonder if that previous office that this patient went to is an assisted hygiene practice. So I want to leave you with, what are you willing to sacrifice your boundaries for? You may absolutely love assisted hygiene, but are you capable of incorporating everything you need into that 30 to 40 minute appointment? Again, cleaning, I go around 5 times. I know that I cannot do that. I cannot provide the counseling that I need to give to my patient on how they can improve their oral health. Again, lifestyle, nutrition, talk about inflammation. These are all very important things. And so I ask you, are you really into this? Are you really into assisted hygiene if you are one who says you are? And if you are someone who doesn't want to do assisted hygiene, then don't give in. Don't buy into it. Set a clear boundary. Let's all lock arms together. And the more we say no to this, the faster we're going to put a stop to this, because this is not actual healthcare. I am not a teeth cleaner. I am an oral health prevention specialist, and so are you. Let's do that. Thank you.